So I find myself wondering why would the county council want to part with such good service in a new building, a beautiful building, right at the heart of a community that's accessible to people? And I tell you, this is my assessment of it. They fundamentally do not believe that a public body should provide a service that a private organisation can make money out of. And I think that's the bottom line. And they make a case for why it's underused, for why more people want to receive care in other settings or at home. And I accept some people may want to receive care in other settings or at home. But they've run these services in an inefficient way. There was a round of consultations earlier this year which led to the closure of Brian Close House in Borough Wash. And one of the points that the council made about that service was that it was underused, but the reality was whole sections of the home were closed off, so they couldn't be used at all. So that is it policy-based evidence making that we were talking about? So they're creating a climate whereby the service looks underused or undervalued, and then therefore they feel the need to close it. So what does the county council do? It wouldn't be right for me to come here and just list a load of issues with their service or their approach without offering them solutions. The last government introduced integrated care boards and integrated care partnerships, and that brings all the people involved with providing care across the community together. So that's acute services, it's mental health, it's adult social care, it's care for young people. And we're just not using that vehicle well enough. The stakeholders within the sector are not collaborating and talking to each other in the way they should. And I understand that the respite beds, the care beds, which were a consequence of changes at the Babington, which are in the Ada Belfield Centre, are not being used in the way they should. And I'm leaning on the council and the integrated care board to understand why that is. The government has already made changes, the new government, to make sure that the NHS and adult social care are funded better. Part of the last budget saw over £25 billion be poured into the NHS, and I urge the council to wait for that money to hit the front line and work with the NHS to ensure that it uses those respite beds, money that it can claim back from the NHS to ensure the service is sustainable. And the government has also found £600 million for adult social care across the country. I recognise councils are in a really difficult space. They've had 14 years of cuts. But we are turning that tide now. We are turning that tide. And if only the political leaders at the council would give it time to filter through, I believe that they could save this service.